Is eating saturated fat going to kill you? And do you need to limit saturated fat in your diet? Well, no, most likely not. But you've likely heard from well-meaning doctors or dietitians that you should avoid or minimize your saturated fat intake, and therefore you worry about eating meat and cheese and butter or certain oils like coconut oil. But it turns out that advice is misleading and has little application to your health as an individual. And the fact that medicine and nutrition authorities so strongly believe it to be true just highlights what's wrong with nutrition science and how we make health recommendations. So let's explore why this is wrong, what it might mean for you as an individual, and whether saturated fat containing foods could be part of an overall healthy diet. I'm Dr. Brett Scher, Director of Metabolic Mind, a nonprofit initiative of Bazooki Group, where we focus on the intersection of metabolic health and mental health, and metabolic therapies like ketogenic therapy as a treatment for mental health disorders. Now, first, before we get into the details, please remember our channel is for informational purposes only. We're not providing individual or group medical or healthcare advice or establishing a provider-patient relationship. Many of the interventions we discuss can have dramatic or potentially dangerous effects if done without proper supervision, so consult your healthcare provider before changing your lifestyle or medications. Okay, but now, let's be clear of one thing first. Ketogenic therapy, which is what we talk about a lot here at Metabolic Mind, it doesn't have to include any saturated fat. Numerous people are using a vegan or a dairy-free vegetarian keto diet as the mainstay of their ketogenic therapy to treat mental health disorders. Now, we often assume keto automatically equals, right, bacon-wrapped steaks cooked in butter, and it may, but it doesn't have to. Ketogenic therapy is compatible with pretty much any dietary approach. Vegan, vegetarian, Mediterranean, carnivore, and plenty in between, as long as you achieve the metabolic state of ketosis. Individuals have different reasons for eating vegan or vegetarian, but should fear of saturated fat be one of those reasons? I would say no, it probably shouldn't. And what brings this topic up now? Well, there was just a paper published in the journal Systematic Reviews titled Saturated Fat, Estimated Absolute Risk and Certainty of Risk for Mortality and Major Cancer and Cardiometabolic Outcomes, an overview of systematic reviews. Now, there's a lot in that title, but first let's look at the term absolute risk, right? Absolute, not relative risk. We often hear that there's a 10% reduction in events by reducing saturated fat, but what does that really mean? Well, that can mean a reduction from 50% events to 45%, which is a 5% absolute risk reduction, or from 0.5% to 0.45%, which is a 0.05% risk reduction, right? Both are a 10% relative risk reduction, but a dramatic difference in what that really means. So when it comes to you as an individual, trying to decide how much of an impact something has on you, absolute risk is much more helpful than relative risk. But, relative risk sounds more dramatic. It's a bigger number, so it's often used to grab our attention, but it means almost nothing for us as individuals. But the next part of the journal article title says certainty of risk. The authors didn't just stop with, quote unquote, the evidence shows, right? We often hear the evidence shows saturated fat is bad for us, but what kind of evidence? What quality of evidence? And this is crucial because the authors found that much of the evidence supporting a so-called risk of saturated fat was low or critically low quality evidence. And I can't emphasize this enough. Whenever someone says the evidence shows, our immediate reaction should be, well, what quality of evidence? What kind of evidence? Because not all evidence is the same. Now, I won't go through all the findings in this study because there were many of them, but here are a few highlights, right? So one, when looking at cancer mortality associated with reducing or replacing saturated fat, they found a range from 8 fewer events to 3 more deaths per 1,000 people. And the certainty of evidence was very low to low. So it could help or it could hurt you based on that evidence, reducing saturated fat, right? Doesn't make sense. But that's not the message we hear. Or for cardiac mortality, they saw a reduction of 2 deaths per 1,000 people, again, with very low or up to moderate certainty of evidence, 2 per 1,000 people. So that's not nothing, but my guess is it's much less than most people would assume based on the strength of the message we give about saturated fat and cardiac risk. Now, to be fair, this paper did not conclude there was no effect of saturated fat on health. Like one of the studies they looked at cited 20 fewer all-cause deaths per 1,000 people who reduced their saturated fat intake. And that was moderate quality evidence. Now that might be noteworthy for many people, but here's the key. What does it mean for you? Now remember, most of these studies were done on people eating the standard American or standard industrialized diet. And when we hear saturated fat, the recommendation is to limit meat, cheese, and butter. But you know what form or types of food are the most common ways we get saturated fat? So according to one site, the number one is sandwiches, which sure might have meat, but also lots and lots of bread. And next are desserts and sweet snacks, cookies, pies, ice cream, followed by rice or grain-based dishes. So pasta dishes with meat and a creamy sauce, or a meat and rice dish with a creamy and sugary sauce. And next is pizza. I don't think I need to say more about that with the sugary sauce and lots of flour. And then milk and yogurt are next, and most of the yogurt is flavored or sweetened. And then finally, after all those is when we get meat or poultry alone, right? They're lower on the list, and then followed by chips and crackers and savory snacks. So why do I bring this up? Well, you can see the picture that the data isn't based on someone eating a whole food, low carb diet with meat, cheese, eggs, avocado, veggies, and nuts. So for me personally, I know the data has nothing to do with me. For my patients, I know the data has really nothing to do with them. So what about you? Does this data have anything to do with the way you eat? Now, let's face it, nutrition science is full of low-quality evidence that applies to a general population eating a low-quality diet. And that's not the type of evidence we should use to make individual recommendations about specific foods. What is a study with low quality of evidence showing a minimal increased risk from saturated fat in a general population mean for you if you're using a ketogenic therapy to treat a neurologic or mental health disorder? I would argue it means next to nothing. And what's more important, though, is you deserve a healthcare team that realizes this, that treats you as an individual and assesses your diet as a whole, not just based on general items like saturated fat. It's time we recognize the limitations of nutrition research and stop trying to make it something that is not, right? Stop trying to use it as a definitive declaration for how everyone should eat a quote-unquote healthy diet. So that's my takeaway from this recent paper about the quote-unquote health risks of saturated fat. We really need to be more individualized. If you're interested in learning more about the safety and efficacy of ketogenic therapy for treating mental health disorders, please follow us at Metabolic Mind, a nonprofit initiative of Bazooki Group, where we get into some of the details and nuances that you need to know. Thank you for watching. I'm Dr. Brett Scher, and we'll see you here next time at Metabolic Mind.